Researchers from the University of Adelaide and the University of Tasmania conducted a study assessing the composition of over 50 engineered stone products, identifying potential risks to lung health. The study found that metal components in engineered stone, such as cobalt and aluminum, may be hazardous to lung health, leading to inflammation. Unlike natural stone, engineered stone emissions contain up to 20% resin, with the potential for resin breakdown during cutting and grinding, generating harmful chemicals. The research suggests significant implications for newly emerging stone alternatives, particularly those labeled as reduced-silica or silica-free. Earlier research showed that processing engineered stone can expose workers to high levels of respirable crystalline silica, a known carcinogen. Silicosis, a disease from RCS exposure, develops faster with engineered stone than with natural stone, leading to more severe conditions in a shorter time. The researchers hope their findings will contribute to meaningful regulations for engineered stone production, safeguarding workers from occupational lung diseases. IKEA and Bunnings have already banned engineered stone products linked to silicosis, following Safe Work Australia's recommendation for a complete prohibition.
If you enjoyed this video, please give it a thumbs up and subscribe to my channel for more great content.